In this video, I'll explain all the different age profiles of students who undergo dyslexia therapy. Even though it'd be my dream that all children with dyslexia are identified before they start their school journey and begin early intervention so that they learn the components of literacy the way their brains need it the first time, before all the hurt, self-doubt, and parents' worry starts, this is impractical. The truth is, too many kids don't find out they have dyslexia until they are much older, when they've had years of failure under their belts. At Dyslexia On Demand, we get all profiles of students. They're not all 7 years old, and this means that therapy cannot be a one-size-fits-all approach. Some most fortunate kids come to us at 5.5 for early intervention. Some kids do come to us at 7, but most are in late elementary, in middle school, or even in high school or adults. Working with a 5.5-year-old and working with a high schooler are two very different circumstances, but that's part of our job description as a certified academic language therapist. Additionally, not every student we get is newly identified with no intervention experience under their belts. Many have already been working with a therapist and their situation changed, and now they need a new therapist. Or they've received some Orton-Gillingham instruction through the school, but it isn't proving effective in their situation. This means that when we get a new student, we must make very prescriptive decisions and answer the questions of who is best suited to service this child and how Dyslexia On Demand can best serve them. In each situation, we'll evaluate the approach that is best suited for them based on testing data, educator input, and information from the parents. When a child is younger than middle of first grade, typically speaking, their needs are best suited with an early intervention evidence-based program that are going to target their critical needs at that age. Conversely, when we have a much older student, when it's profile appropriate, we also can do an approach that is more fast-forwarded to their current needs as a high school or college-age student. Regardless of the approach your therapist takes with your child, you can always trust that it is individualized for their needs and data-driven prescriptive choices are made to tailor it to their specific profile. The most important takeaway is that when you work with Dyslexia On Demand, you can be assured that because of we exclusively use certified academic language therapists, you're choosing the highest level trained dyslexia professional out there. And therefore, you're placing your chips in the professional versus the name of the program. As CALTs, we understand that there are no factory settings in our approach and that we must individualize to make our work most effective. In a peer therapy environment, we're not delivering a curriculum, we're prescriptively plotting their therapy journeys and continually double-checking our choices using data as our driver. When you work with Dyslexia On Demand, you can trust that our expertise, individualization, and therapeutic programming set us apart. Please visit us at dyslexiaondemand.com for more information and informative videos to help explain how we can best help your child. Also, please like and follow to see all of our videos as they're released.